Acceptance is rooted in authenticity, being respectful, providing emotional safety, free from an agenda, no judgment, no shame. Even when there's differences, you're going to not agree or difficulties. If a patient is experiencing anxiety or concern about a procedure, meeting their feelings, we're not trying to fix anybody. We're not minimizing or dismissing them, acknowledging that their feelings are valid, you know, acknowledging that, promoting a sense of worthiness and belonging is so important for acceptance. A lot of people with trauma, they never felt accepted. They never got the attention that they needed as a child growing up. They felt alone and scared, especially developmental trauma. I don't think the world gives enough appreciation. I think gratitude and admiration for any and every little thing, validating your courage, effort, your unique qualities, appreciating, encouragement, faith in another person's potential, that fosters the closeness that they need, recognizing the value. Take some time, acknowledge. Sensitive topic. That was a sensitive topic. You are resilient. You are strong. You can do this. Thank you for trusting me to do this for you. Reinforces this hope and this bond. Showing affection, kindness and warmth, affection in your words, gestures, language, all of these things. Affection, when appropriate, is so important. Offering comfort is extremely important. Signaling this emotional partnership and allowing, I think, is really important. Creating an atmosphere, patients feel welcome. Somehow, Cook County Hospital was able to nail it. This developing welcome, allowing, being flexible, being forgiving, this willingness to let patients guide aspects of their care, not everything, right? Without being reducing, it will reduce some defensiveness because nobody wants to feel judged. And there's so much shame that trauma survivors bring into the situation. They're ashamed. There's so much shame. You don't want to cause that shame in them, making sure that they're safe in their care. And how I was really able to kind of blend these two to come up with a mindful approach to the care that we give, atoning, enter, attune, giving the attention, attuning to unbroken attention to what the patient needs, really being present eye to eye. I mean, I have seen where there is just like chaos going on in a delivery room, chaos. But I've seen physicians come in and just pull up a chair, sit eye to eye. All sorts of things are happening here. They're able to attune and say, okay, here's what's going on. They're able to focus and, not being distracted, showing that empathy and concern. Here's what we need to do today. Here's what's happening. And it's like really getting there. And that increases all of that safety, allowing, prioritizing safety, respecting personal boundaries. All of these things are so important. Allowing patients to set the pace, sensitive exams reinforces a lot of these principles. Clear communication, accepting